Hello friends. In this video we are going to talk about dietary approach to stop hypertension, commonly known as DASH. DASH is a diet recommended for people who want to prevent or control the hypertension. The DASH diet focuses on fruits, vegetables, whole grains and lean meats. Following are 7 sample Indian diet plan for high blood pressure problems. 1. Early morning food items can be 1 tablespoon of roasted flax seeds or sunflower seeds, 1 cup tea without sugar, 2 pieces of high-fiber biscuits like Nutri-Choice. 2. Breakfast items can be 2 small stuffed carrot or spinach paratha made with whole wheat flour, 1 cup curd without salt, or 2 egg white omelette, 2 brown bread slice or 1 roti. 3. Mid-morning items can be 1 med-sized apple or banana or guava or orange, green tea without sugar. 4. Lunch food items. 3 medium-sized chapati with little or no oil, 1 bowl of mixed vegetable salad, 1 med bowl of dal, 1 medium-sized bowl of capsicum or lady finger or parval or torai or bottle gourd vegetable. Or vegetable brown rice and 1 soup bowl with mixed vegetable salad, 1 bowl, 10 minutes walk post-lunch and 1 cup warm water with lemon or green tea without sugar. 5. Evening food items. Green tea or normal tea or coffee without sugar or 1 cup of beetroot juice, 2 wheat rusks, watermelon or its juice. 6. Dinner food items, 3 medium-sized whole wheat flour chapati, 1 medium-sized bowl of mixed vegetables, 1 small bowl of kadhi or dal, 10 minutes walk post-dinner and 1 cup warm water with lemon or green tea without sugar. 7. Bedtime items, 1 cup cow's milk without sugar, 4 to 5 soaked almonds. Few of the Indian food items that can help in controlling blood pressure: flax seeds, sunflower seeds, watermelon, beetroot, spinach, whole grains. Here are some dietary changes required to maintain blood pressure. Eat a low-sodium diet, include lots of fruits and vegetables in diet, limit alcohol intake, reduce caffeine intake, stop smoking, eat only whole grains, avoid high-fat diet, limit your sugar intake. Along with good diet you need to add few of the basic things in your lifestyle like regular aerobic exercise for at least 20 to 30 minutes a day for at least 4 to 5 days a week. Maintaining and keeping check on weight. Monitor your blood pressure regularly. Keep stress at bay. Make sure to subscribe to our channel to get latest video first. Thanks for watching.